You need an IV giving set, IV bag, flash, 0.9% sodium chloride flash, 2% chlorhexidine in 70% alcohol swab. Good afternoon.
I'm good.
My name is Susan. I'm your nurse for today. I see you have an order for IV fluid, but first I need to make sure that I'm administering it to the right person. What is your name, please?
Michael Jordan.
Can I confirm, please?
Sure.
Michael Jordan. Thank you. Like I had told you, you have an order for 0.9% sodium chloride solution, which is going to be administered overnight. Is that okay with you?
That's okay.
Thank you. Inspect it by stretching to ensure that you have the correct IV fluid giving set. And this is the right one. We have the spike. Here, it is covered with a plastic sheath. It should always be maintained sterile because it is the part which is going to get into the sterile fluid. We have an air port here, which can be opened sometimes to help in infusing the fluid. And here we have the fluid chamber, which should be a third full to help the nurse clearly visualize the drips being infused. This is the clamp roller. It is used to control the rate of fluid administration. If you want to close it, move it down and press it until you reach the bottom. This way, the line cannot move, so that means your line has been closed and there's no fluid being administered. If you want to open it, move it up and it will get loose so the line can keep moving. This means that it is open. But for now, let's keep it closed. And this is the injection chamber, which can be used to administer medications during infusions. However, it can hide air. So ensure during priming, you have expelled all the air from the injection port. After inspecting your IV line, you need to attach it to the IV fluid bag. You can do it in two ways. You can either attach it when it's down here, raise the neck. There are two necks here. This one, the orange one, is for giving medications or injecting medications into the fluid if you need to add other medications, and the clear one is for connecting the IV giving set. So you can either attach the giving set from down here, lift the bag at an angle, remove this part, then attach the spike to the fluid bag. Alternatively, you can put the bag on a drip stand, press here, remove this bit, then attach the hook to the fluid bag. For today, we'll attach it when it's down here. So you remove this bit, ensuring that you keep the hook sterile. Insert it into this pot. You can squeeze it until it is inside, completely inside. Then hang it up. Now you need to expel air. from the giving set, or rather prime it. Squeeze the fluid chamber. Let the fluid come until it's a third full. Then allow the fluid to start dropping slowly. Invert the injection port. So you allow the fluid slowly to drain. So as the fluid gets through the injection port, give it a little flick. Dislodge the air so the air is out. You can let the fluid drain into a receiver. Remember, you need to flush your cannula before fluid administration. So you need to get your 2% chlorhexidine in 70% alcohol. And you also need to prepare your flush. Remember, you remove the cover, push back the plunger, then expel air, then return the cover. Then now you can get your swab. This is to prevent introduction of microorganisms into the bloodstream. Then let it dry for 1 minute. Then disconnect your cover and attach it to the hub by pushing and squeezing. And clamp. And remember, during flushing, you have to withdraw to confirm that the cannula is still in place. And you can see here, there's blood, the cannula, then flush. So you flush, pause, flush, pause. There, we are done. So please remember to clamp the extension tubing, because there may be backflow. Ensure that the hub doesn't touch anything. Then get back to your IV fluid giving set. It is ready to be administered. So remove the plastic cover. And now you can connect to your IV extension tubing. Ensure that it is tight. Then unclamp. Now you can start your drip. Remember, there are orders for the rate of fluid administration. So you have to set the drip as per the requirement or as per the order. Do not leave the patient's bedside until you have confirmed that the fluid is flowing well and the cannulation site is intact, it is not swollen, and the patient is not in pain. Mr. Jordan, are you in pain?
No.
Are you okay?
I'm quite good.
Oh, okay. After you've confirmed all this and set the drip at the required rate of administration, then you can remove your gloves, dispose the waste, perform hand hygiene. Do not forget to label the administration set.